Well, September is Suicide Prevention Month, and we want to spread the word. Suicide is preventable. Every year, millions of Americans struggle with suicidal thoughts, and thousands will take their own lives. So, at the VA Lexington, suicide prevention is a top clinical priority.
And on September 10th, Lexington VA will be hosting a health fair and PACT Act event for World Suicide Prevention Day. So with us today is Dr. Autumn McCane, Mental Health Chief, and Dr. Rachel Hempel Rhudy, Suicide Prevention Coordinator. Ladies, thank you so much for being with us today. Yeah. We appreciate it. So let's talk about suicide prevention and why it's so important for the VA health system.
It's so important because when you look at our veteran population, they are at an increased risk of suicidality. And so we make that a top priority, and we have a huge team ready to serve and assist veterans. We go out into the community and provide a lot of outreach because it takes a community to prevent suicide, and we want to normalize that it's okay to talk about it.
Yes.
Talk about how we're feeling, get our loved ones help, get our veteran community the help that they need.
Yes,
so important. So let's talk about what services the VA provides, in particular to our veterans for suicide prevention.
Yeah, so we have a robust suicide prevention team. As you all mentioned, I'm one of our suicide prevention coordinators. We have another coordinator, several case managers. So when a veteran is considered to be high risk for suicide, our team is following them closely. We're making sure they're getting referrals to evidence-based treatment for suicidality, making sure they're getting treatment for things like PTSD or substance use. And our team is checking in typically weekly outside of those therapies and medication management to make sure that veterans are dealing with those thoughts of suicide so that we can hopefully reduce them as much as possible.
Right, absolutely. And Dr. McCane, what are the signs of suicide, and how can we tell if someone is really struggling?
Some of the things that we know are often related to suicidality is difficulty sleeping, increased physical pain, addiction can be a large piece of the picture, and just depression.
Yeah.
What is that first outreach? What does that first statement look like when you're getting that feeling that we may not be going down a road we should go down? What's the first thing someone should say to someone?
Yeah, so generally, like Dr. McCane was saying, we're looking for what's going on with this person's behavior and maybe what are they saying. So we might have people that are very direct. They might say, I want to kill myself, or I'm thinking about suicide. But generally, people are going to be a little more indirect. They might say things like, I just can't live with this pain. I can't go on much longer. Soon you won't have to worry about me. So when we hear things like that, we want to, just let people know it is okay to ask about suicide. We don't want people to think that's a bad word. So we're going to ask our friends, hey, I'm worried about you. I've noticed you're drinking more. I've noticed you're not sleeping well. I'm worried about you. Are you having those thoughts of suicide? And if they say yes, we want to get them to the help that they need.
Right. Well, let's talk about this event tomorrow that you all are hosting. What can folks expect, and where and when?
Yeah, so it'll be tomorrow, September 10th, 10 a.m. to 1 p.m. It'll be at our Franklin Southlick campus off Leestown Road. So it'll be hosted by Suicide Prevention, and we'll also have a number of different services. So we'll have pharmacy, primary care, women veterans health, prosthetics, all to talk about how we contribute to this role of suicide prevention. We really believe that suicide is not just a mental health issue, it's an everyone issue, it's an everything issue. So we want to make sure that people know how primary care works together to prevent suicide, how pharmacy works together, and not just think of this as a mental health concern.
Absolutely. Well, ladies, thank you so much for coming in today. We really appreciate it. Such an important topic.
And thanks to the entire team at VA Lexington. Tremendously important work you all are doing out there for our vets.
Thank you.
We're back with more. Stay with us.